Welcome to Health Diagnosis. Today we're talking about one of the most dangerous viral infections known to humans, the rabies virus. Even though it's rare in many parts of the world today, it remains a serious global health issue that deserves our attention. Rabies is caused by a virus that affects the central nervous system, that means the brain and spinal cord. It's usually transmitted through the bite or scratch of an infected animal. Once the virus enters the body, it travels along the nerves toward the brain. When it reaches the brain, it causes inflammation, leading to severe symptoms and, if untreated, almost always death. The most common carriers of rabies are dogs, bats, raccoons, foxes, and other wild animals. In many developing countries, dog bites are the main source of human rabies infections. It's important to remember that even a small wound can be enough for the virus to enter the body. After a person is bitten, the virus doesn't show symptoms immediately. There's an incubation period, usually between 1 to 3 months, but it can vary. During this time, the person may feel completely fine, while the virus silently travels through the nerves. When symptoms do appear, they start subtly. You might notice fever, headache, weakness, or discomfort at the site of the bite. But as the infection progresses, things become more serious. The virus begins to attack the brain, leading to anxiety, confusion, agitation, and sometimes hallucinations. One of the classic signs of rabies is hydrophobia, a fear of water, where the patient feels severe throat spasms when trying to swallow liquids. There may also be difficulty breathing, excessive salivation, and paralysis. Once the symptoms begin, rabies is almost always fatal. That's why prevention is the most important part of controlling this disease. The good news is that rabies is 100% preventable with prompt medical attention. If someone is bitten or scratched by an animal, the first step is to wash the wound thoroughly with soap and running water for at least 15 minutes. This simple step can remove a significant amount of the virus from the wound. After cleaning, the person must immediately visit a healthcare center for proper evaluation and treatment. Doctors may recommend a post-exposure prophylaxis, or PEP. This includes a series of anti-rabies vaccines and, in some cases, rabies immunoglobulin. These treatments are highly effective when given early, before the virus reaches the brain. That's why acting quickly after an animal bite can be life-saving. For people at high risk, such as veterinarians, animal handlers, or travelers to areas with many stray animals, a pre-exposure vaccine is available. This vaccine helps the body build immunity in advance, making it easier to fight the virus if exposure ever occurs. Controlling rabies isn't just about treating people, it's also about preventing infection in animals. Regular vaccination of dogs and cats plays a major role in stopping the spread of the virus. Public awareness, animal control programs, and community education are equally important to break the chain of transmission. Worldwide, thousands of people still die from rabies each year, mostly in Asia and Africa. Most of these deaths could be prevented through better education, timely vaccination, and responsible pet care. Let's also clear up some common myths. Some people think rabies can spread through casual contact, touching an infected person, or sharing food. That's not true. Rabies is transmitted only through the saliva of an infected animal, usually via a bite or scratch that breaks the skin. It cannot pass through unbroken skin or through the air. Another myth is that once symptoms appear, home remedies or traditional methods can help. Unfortunately, that's not the case. Once the virus reaches the brain, modern medicine can do very little. The only real protection is prevention, washing the wound immediately and getting vaccinated as soon as possible. Rabies is a disease that teaches us how critical awareness and quick action can be. A single bite can turn fatal, but the single vaccine can save a life. Always report animal bites, avoid contact with stray or wild animals, and make sure your pets are vaccinated regularly. By staying informed, acting quickly, and spreading awareness, we can work together to eliminate rabies for good. Thank you for watching Health Diagnosis. Stay safe, stay aware, and take care of your health every day.